G'day, my name is Nadia. I'm one of the surgical interns in the Southport Specialty Centre in Melbourne. Here we have a 3D rendering model of a 12-year-old female spayed Maltese mix. She presented to us for left distal limb necrosis after a previous mass removal. At the time, we had the option of a full limb amputation versus a partial limb amputation, and we have elected to go ahead with a partial limb amputation to try and salvage that limb in order for her to be able to walk again on all four legs. With the partial limb amputation, unfortunately we have had to remove the paw pads, and hence she will not be able to bear weight without risking pressure necrosis and other complications associated with a partial limb amputation. So we decided to make her a 3D prosthesis. The first step making a 3D prosthesis involves a 3D rendering model and making that into a file that is applicable for our 3D printer. As you can see, we here have the amputated limb on the left side. Now spinning around back on the right, on our right, and also the non-amputated limb. As you can see, there is a degree of limb length discrepancy which needs to be addressed by our prosthesis. So first we printed the actual stump over here. As you can see, this is a hard plastic replica of a soft tissue model. It will give us an idea of exactly where her soft tissue would be and allow us to print a prosthesis that will account for all these little nooks and crannies that will otherwise make a regular prosthesis less conforming to that leg, and hence increase our chances of pressure necrosis and slippage during during her weight-bearing phase. Our first prosthetic model was a closed-end model, and unfortunately we couldn't fit the actual stump into the model. So then we had a version 2 that looks like this, and you can see that we've opened up the cranial aspect of the prosthesis, made it a little bit sleeker, and we also included little notches on the side for putting on a Velcro in order to keep the limb in place. As you can see, the stump fits quite well into the model, and I think we are fairly close to being able to trial this in real life. So watch your space for exciting times, and we'll keep you up to date.